You are now listening to the Be Your Own #LoveGoals podcast with Moe Ari
and Tiffany.
We just want you to remember that every person, regardless of identity, wants these three things: belonging, authenticity, and love.
And after a decade of partnership, we've learned to co-create these things and so much more.
So from wherever you're listening, we're going to go on a journey of becoming our own #LoveGoals. Now let's get into this episode. Hey, it's Moe Ari
and Tiffany.
And this is the Be Your Own Love Goals podcast. Thank you so much for joining us. We are so excited because this episode is in honor of Black Maternal Health Week. Mm-hmm. I'm not going to talk majority of this episode, but I'm lying. I have questions for sure. There's so much for me to learn, but I'm excited because we have Sabia Wade on our podcast. Sabia Wade uses she or they pronouns, and she's a Black queer CEO, author, educator, full spectrum doula, investor, and expander of Black luxury. Sabia is the founder of Birthing Advocacy Doula Trainings, an accessible and inclusive training program for community care workers and for the village, a nonprofit providing doulas at no or low cost to low income and marginalized communities in San Diego. As a coach, board member, investor, educator, and programming development consultant for organizations throughout the birth and reproductive health industry, every part of Sabia's work centers on liberation of all people through reproductive justice. Her book, Birthing Liberation: How Reproductive Justice Can Set Us Free, is now available for purchase. Additionally, Sabia is a certified Reiki practitioner, death doula, somatic practitioner, human design reader, wedding officiant, and is currently working toward becoming a spiritual director. Sabia is amazing. This episode is about to be so epic.
Yes.
Stay tuned. Let's just go ahead and get in this episode.
I am so excited about our guests for this week. This episode in particular is in honor of Black Maternal Health Week that is actually starting up right now through April 17th.
Yeah.
And I am just so excited for a number of reasons. Black maternal health is something that is super important to me as a Black birthing person, as a doula, and as a person who just really understands how critical and how much of a crisis I would say that we're in right now. And not just focusing on Black maternal health, but focusing on Black reproductive justice. I think that surrounds so many different things. It you know, for some people, it can look like the treatment that we have in hospitals during birth, but for some people, it can be access to care as it relates to PCOS, and the list goes on and on and on. And so I am so happy to have Sabia Wade here today with us. And as you heard her intro prior to this conversation, I'm so excited to just dive right in and to really talk about the state of Black maternal health in this country right now. And so what we like to do is start out with the moral of the story. So Sabia, we know that you are the hero of your own story. And we would love to know what you want to leave our audience with, and your audience as well, with what you've learned over the years. What is the moral of Sabia's story?
The moral of my story is being yourself always pays off at the end. Right? So whether it's like, I think we all have our different ideas of success factors, right? And so like, obviously, usually people generally want money, but we also know that money isn't everything. So it's like, also, what are your success factors? Is it your ability to move on your own schedule? Is it your ability to be transparent and not hold any shame about who you are? Right? Like, what are the success factors for you? Because whatever it is, being yourself will always get you to that point. Because you can't really sustain not being yourself. And we see people burn out, whether it's money, whether it's travel, whatever luxury thing they burn out because they're just not being themselves. So be yourself. It takes you a long way.
Yeah.
Wow.
Mm.
Yeah. I'm hearing in that create success, what success looks like for
Yeah.
you, and
And
what
then
building your life around what is most supportive to you, even like as you got into what your schedule should look like. I
Mhm.
imagine this is good for all kinds,
it's
everybody
Mhm.
can
like
follow that.
exactly. And I think like being yourself in this world can be really hard,
Mm-hmm.
Mhm.
right? But I think also when we think about legacy, right?
Yeah.
Mhm.
Because we have our own like in this time of what we're doing, but really it's about legacy. When I think about legacy, for kids, for whoever, for whatever. I just want to be known for like she was being herself. And like being
Yeah.
Mhm.
herself built these things and not just built businesses, but it built
Mhm.
great relationships. It built
Yeah.
Yeah.
great opportunities. It built great experiences, like being yourself.
Yeah.
Mhm. Mhm.
Wow.
Wow.
So true.
Thank you for sharing that.
Being
Mhm.
yourself
It's an
builds
ongoing lesson, even
legacies.
for
Mhm.
myself.
Mm-hmm.
Yes.
Yeah, that's powerful. If you ever see me pausing, and I'm a therapist, so I'm like really taking it in, chewing on what you said. That was very profound. That being yourself builds legacy.
Mhm.
That probably will end up being a social clip.
Mhm.
I'm quite certain.
But whereas like who wants a legacy was something that you can't recognize.
Yeah,
Uh,
Right? And a lot of times, like, people are like, "Oh,
yeah.
I built this legacy because, I don't
Wow.
know, they got recognized for this one aspect of something they built or
Mm-hmm.
whatever," but they
mhm.
can't even recognize themselves in that moment,
Mm,
Mm.
right? And,
Mhm.
like, you see a lot of,
mm.
people that are like, their stories are always celebrated, but they're always like, "I did this thing, but there was so much more to me."
Yeah,
Right? When I became known as
yeah.
only this one thing that I did, I didn't even
Mhm.
feel like my
Mhm.
legacy is what I wanted it to be.
Yeah.
'Cause I want the
Mhm.
legacy to be who I am, what I
Mhm.
bring to
Yeah,
the world,
Mhm.
like the relationships I
yeah.
have, the
Mhm.
way I parent, the way I right? Like, that's really the legacy
Mhm.
that we wanna build, not just, like,
Mhm.
this one frozen moment that sometimes we're not
Yeah,
Yeah.
even happy in 'cause we're too exhausted to be happy in,
yeah,
right? So it's like, just
yeah,
be yourself.
yeah.
Mhm.
That's, for me, it's kinda like punching me a little bit because I'm thinking about my journey of gender transition, and as a therapist, it's one helped my career tremendously to one work specifically with the transgender community as a transgender person, and then become an
Mhm,
expert in talking about it. And I've been able to speak in spaces and take up space in places that I didn't think that
Mhm.
I'd get that reception. And it was at a point becoming my story, and I was like, this is not, when I began gender transition, that was not the case for me.
Mhm.
It was, I was very clear, this is not going to be my whole identity. This is an
Mhm.
aspect of my identity. But at some point, through the recognition, people calling on me to do certain interviews, speaking engagements, it was like, now all of a sudden you're like the trans therapist. And it's like, I'm a relationship therapist. I'm all about connection.
Yeah.
And so what
mhm.
you're saying really resonates with me just like out the gate. And I'm not gonna make this episode about this because we talking about Black maternal health. We're gonna get right into it.
Listen, we're gonna go through
Um,
levels. Through levels, and I think
Yeah.
yeah.
even like when we think about Black mental health right now, like, and this is like a bit of like what I'm experiencing is that a lot
Mhm.
of us who are doing this work, specifically Black women who are doing this work,
Mhm.
are beyond burnt out because the Black maternal crisis has become how people identify them. So
Mm.
Ah,
literally from, like how they get work is now centered around this crisis, right? And they
Mm.
yeah.
feel very pigeonholed into this, like, even if they want to
Mm,
talk about Black joy, they want to talk about something else that they do, they want to like whatever. It's like the
Yep.
only way that I'm recognized, right, and honored or cared for is if I'm talking
mhm,
about this crisis, which also
mm,
impacts me, right? So like
Mm.
yeah.
I'm moving through,
Mm,
a lot of Black women that come to me are like, I'm moving through this trauma of like wanting to do this work, but also being like, I don't want this to be my whole identity. Like there's so much that I
yeah.
do.
Mm.
There's so much
Mm.
that, I want to celebrate. And there's also
Mhm,
many things in the Black community that we want to celebrate, even with the crisis being a
yeah.
thing. And it's like, how
Yeah.
do we also make sure that for folks who are outside, especially Black identities, like how do we make sure that we're paying attention to the Black maternal crisis and that we're doing the work that we need to do, but we're also recognizing the people who are directly working in it in ways outside of teaching us about the crisis. Do this. Tell us about all those terrible stories that you've experienced. Tell us about your own terrible
Exactly.
story that you've experienced. Like, also, what are their, what is the conversation about their triumph, their, perseverance, about their creativity, about like the life they're building for themselves. Like, we have to make sure that we're doing a thing about a whole kind of holistic approach to it. Because our legacy, especially as like Black folks, can't be just a crisis. It's
Struggle.
very important. But it's also so many of us, including y'all, which is why I'm honoring y'all, are doing work that, right? Like, it goes beyond like, this is a crisis. Yes, we're going to continue to do the work on this crisis. And let me show y'all the beautiful shit that we're creating. Let me show you about Black love. Let me show you about Black joy. Let me show you about Black kids and how they're like creating something that was beyond us, right? So it's like, there has to be a balance, and people have to be allowed to be their full selves, even in the process of doing reproductive justice work.
Wow. I love that you said that, Sabia. And I don't,
seriously.
I don't know if you remember, but when we met last year at the Juneteenth celebration, I was talking to you and I was saying, at that point I hadn't attended a birth yet. I had kind of been new to the birth working field. And I was like, I'm a doula, but I was telling you, I want to be a different type of doula. Like, I want to, do more holistic. And I don't really know if that's considered a doula. And you asked me this very profound question, which is, it was profound, but it was so simple. You were like, do you say you're a doula? And I was like, yes. And you were like, okay, you're a doula. And it was just, and I was like, wait, is that simple? And I think what you're speaking about is how, because of this Black maternal health crisis that has been happening, I had very much seen or been programmed to think that as a doula, you're like rushing to the hospital and in need and in crisis. And it's not like this other work that I think is really important, like the holistic care, the joy, the yoga practices, the breath work practices, all of the stuff,
The life beyond the crisis.
And also creating this life where we don't even have to, interact with these systems or really do the advocacy at the ground. And for me, that was not what the definition of a birth worker or a doula was. And so when I was having that conversation with you, I'm like, well, I don't really think this is a doula. And you were like, do you say you're a doula? And I was like, yeah. And you were like, you're a doula. So that has really set,
it changed your world.
Yeah.
It speaks to, right? Like, one, you're a doula if you're a doula, right? And like, that's gonna look different. I think what's important to recognize about doula work is your approach, right? Like, is your approach one of someone who's centered in care? Is your approach, in my definition, something centered in advocacy? Is your approach also centered in autonomy, right? Like, these are the things that to me create a doula. Then when you call yourself a doula, are you doing these things? Okay, then you're a doula. And I think that a lot of times, like, we wait for people to qualify us, right? And I think that's also, we're talking about the Black maternal health crisis. We need more doulas. Like, we need more doulas, right? So it's like, when people are waiting for something to qualify them, I'm like, okay, you need that permission right here, right now. Here's your permission. You're a doula. Now go get to it. Like, go get to it. You don't have to think about, well, and I obviously, like my training organization, Birthing Advocacy, like, we have people, come into the space and love education. I love that. But also we tell people, like, when you finish this course, just go into the community and start doing things. Right? Because like sometimes people in that need to get qualified, especially Black, brown, and Indigenous folks, because we have been so pushed down about if we're qualified, especially in regards to traditional, like, care work. It's like we tend to go, okay, well, I got to go to this training, and I got to go to this training, and I got to go to this training, and then I have to have 10 certificates, and I have to have 10 things that tell me now I'm fit to go into the world. And most of it, honestly, is like, oh, okay, get a foundational knowledge, love that, right? But just go do the work, because a lot of the work and the things that you're going to learn is going to come with being around people, right? So if you're providing education, if you're providing breath work, if you're providing yoga, whatever you're providing, like, it's going to be met in community, and you're gonna practice it in community, right? Like we don't heal in isolation. And like when people try to be like, I'm gonna go learn this over and over and I'm gonna wait for my qualification, I'm like, baby, it's people that we could be healing. And because you're isolating yourself, right? You're isolating yourself in this like student experience. I have to sit and learn everything. I'm like, we're slowing down the healing here. Let's go. And like you're saying, Tiffany, too, like being a doula is not just like, I think some people are like, there's so much education I need to provide. Like that can be a part of it and you learn it with time, right? But a lot of it is really just sitting with somebody and be like, how are you feeling today?
Exactly.
What's going on? Like, how's family? Like, do you have enough to eat? Do you need to figure out childcare situation? Like what's like that is the work of a doula, and that doesn't take training.
Yeah.
That's a word.
Wow.
I always say that I want my approach always to just feel like I'm your friend, you know, whether like you're saying, how are you doing? Do you have enough to eat? Is there anything I can do to help you? Like, I think it's just that simple, and it's become overcomplicated for so many different reasons. Like you're saying, I've been guilty of saying, "Oh, I need this training. I need this. I need that." And in the moment, in moments that I realize I have literally everything that I need to be able to simply show up, care for, and be empathic to people, that's when I really was able to stand in like, I am a doula. I am in this space and I deserve to be here and I am good at what I do.
Yeah.
And that's like a lot of the gaps that we close as doulas, especially for Black folks, right? Because a part of like, so one of the things that I like do trainings for groups of people is home visitors. And so home visitors are tend to be like social workers, nurses, whatever. And so they go into people's homes. But I mean, they can be helpful, right? But the hard part about them is that, especially a lot of people of color, don't go through in their household because for a lot of home visitors, they've been taught a certain way of the standard of like, this is you're being successful as a parent or you're not, right? So like a way to kind of like think about that is, let's say that you live in a Black multilingual household, right? So let's say you speak Haitian Creole, right? And your kid at 1 year old can tell you 30 words in Haitian Creole, but tell you 3 in English, right? For a home visitor, it's like, oh, they don't have the language that they need. We need an intervention. More so when they know 30 words in Haitian Creole. So actually they probably know more than the average 1-year-old. And they know 52 languages.
Yes.
Right? Like, so like that kind of space is also often why a lot of people of color are like resistant to people coming into their household. Right? You don't understand like culturally why their house looks the way that it looks, why they eat the food that they eat, right? Like it becomes like a space to enter you into a system that you don't want to be entered into. Right? Because once you get in the system, it's really hard to remove yourself from that system. But I think like doula, especially for Black folks, we come in with usually cultural congruence to say like, okay, I understand why we eating what we eating. I understand why we're saying what we're saying. I understand that the words that your child may understand may be something that's culturally significant to us, but not necessarily understood by people outside of us. Right? Like I understand these things. So I think like with doulas, because of that kind of advantage, we've been able to fill these gaps that medical systems can't. We're going to your home, we text you in between, like, hey girl, what's goody? Like, you know, like we're able to like create, you know, like, I don't know how many of my clients where my prenatals were like, girls go to the nail salon, girl, let's go get something to eat. Girl, let's like what we're doing, right? And let's kiki, period. You know what I'm saying? So like, with that, like the importance of that, and that's not just like what to expect at 6 months, right? It's like what's going on with you? How do we move this way? Or even we're thinking about nutrition, like some of I would have our American diet. You need to eat these vegetables, these things. So I'm like, okay, what if we make a healthy version of greens? Okay, what if we pull back on some of the fat, right? But like, how do we make this in a way that can help you meet this nutritional goal in a way that is congruent with who you are, right? And I think especially in the postpartum period is where we see a lot of problems, right? When we're talking about the maternal health and like that 6-week period, a lot of times people have a birth and they have their baby and then they don't get checked for 6 weeks. So even at my nonprofit,
Yeah.
we have incidences where a doula will kind of check their client, the next week or whatever. And we probably will be the only one care provider that's really checking in with them every day for that 6-week time period. And that, helps them to keep their lactation journey going because they're able to express, hey, can you come over? I need help with this, or can you get the IBCLC that's on team and help them. But also, we've had clients where you're like, I just have a bad headache. And because of the world, the conditioning, you're like, oh, this is just a part of the process. We come to find out they have postpartum eclampsia. Right. And we're like, we got you to the hospital. But if it wasn't for their doula saying, maybe we should go to the hospital. I know you think it's a little whatever, but we should go get checked. Like that would have been another death.
Yep.
Right. And like that's like the importance of a doula and the role that we play in this crisis is that we really are, for a lot of people, their first touch point.
Yeah. Yeah.
Yeah, I'm sitting with that. I think, I understood the importance of doulas before having a baby, but after having a baby, it became fully online. And particularly having that experience summer 2020 in the middle of the pandemic, having to navigate all of that, which, oh my God, it's a whole other podcast. So, but I really understand how important it is to just have a person who cares about you. And as you're speaking about, traditionally for birthing people, you have the baby, and 6 whole weeks later is the next time you have communication with the provider. It's like a lot can happen in 6 weeks.
Right.
We know how much can happen in a matter of hours.
We see people die from infection in 6 weeks, right? And it's not because, and it also has to be like, different narratives written about those types of deaths. So people are like, well, they're being negligent. They knew they had an infection. They knew and it's like, first of all, one, education is a big part of it. If you don't know what to expect after birth, you don't know what to expect. 2, there's also like social determinants. Being low income decreases your access to going to hospitals literally easily. How do I get there? Right? If you have other children, where is childcare? Right? Like there's so many factors that go into it. It's not just someone being negligent, more so than building a full story around that person. And it's also not to say that some people are reaching out to their care providers and not getting answers for a week later. They're not to say that they're not, telling them whatever and not giving them what they need, right? Like, and I think also that's the importance of doulas because we create this full story. Right? Like I had this doctor friend, and she like, trains doctors and all that, whatever. And one of the things that she was making them do was kind of like going out into the community because I think one person had like a patient who had, whatever medical conditions they had. And they were kind of being seen as negligent because they weren't coming to their appointments and they weren't taking their meds all the way. And like, they're half-sizing their meds, right? Because a lot of people don't have access to the medicines. It's split in half and it's not an effective dose, right? But she makes her doctor actually get full stories of what's happening. And so when you look at the address of the person and you look at their location and their access to transportation, they didn't have it. Right? So this person not just coming because they're trying to be negligent around their health. Everyone wants to feel good. Who don't want to feel good? You know what I'm saying? But it's like, I feel like in certain spaces, like physicians, even midwives are not out of this story, right? Like any care provider, they create this one narrative of this person doesn't care or they're a bad parent or whatever, and they don't create the whole full thing. The way that doulas are like, well, what's the social determinants? Like, where do they live? What do they have access to? What's their diet? Like what's happening with them? So to create a full story of what could be happening here, and then from there creating real actual help. Some people have like a false like, oh, if they just have this, it'll be fixed. And it's like that's not their actual issue. Their actual issue is this. You're not feeling that. You're only feeling this thing that you can think of instead of actually solving the real problem. And give people money. Really, that's usually what it is. Give people money. Don't give them a car ride. Give them money to pay their rent. Right? Give them money to like send their kids to daycare until daycare that's high quality. They're not scared the whole damn time.
Exactly.
Right? Like, give people money. and trust them.
Yeah.
And I feel like that's what we aim to do as doulas.
Yeah. That's so powerful.
Yeah.
I'm just like breathing it in. I'm hearing well, I just am hearing so many stories in that. I'm just thinking about how when Tiffany came home from the hospital, this changed my world. I became more aware of like the importance of doulas, and we couldn't have anybody really at that time, so I had to do breathing exercises and all this with
He was
Tiffany.
being daddy doula.
I call myself daddy doula. She had hypertension in the hospital, so I was doing everything I knew how to do as a therapist to get her to like stay breathing. And we saw like after she had been doing deep breathing, her blood pressure was going down. So we're like keep doing this because we wanted to stick to her birthing plan, and they were kind of threatening like, you know, we're gonna have to do some other stuff if it goes too high. So we were able to successfully deliver vaginally, but we were really going through it. And after we got out the hospital, I realized how a lot of people's focus was on our daughter, which I love. I'm like, that's great. But I was at a point, I remember crying to my parents, like, Tiffany needs something and I don't know how to give it to her because I'm just seeing that she's going through a lot. And so I'm wondering from your professional experience, if partners are present at all, because everybody doesn't have like a partner, but maybe they have a support person. What's your advice to support people? Like what overall in your experience, I know you can't generalize for everybody, everybody's different, but what do you think support people really need to know from your experience?
Yeah, so I think like it's so funny, right? So the other day I posted about World Doula Week, and some folks like, you know, like obviously in the caption is like birthing people, like, you know, whatever case may be. So how if people come on, you know, do the things that people do, they're like birthing people, you're raising women, right? Do the whole thing. Okay, cool. So like, first of all, the image clearly has women in it. What are you talking about? But like two, like when I say birthing people, I'm not saying women are not included. I'm saying, hey, tell me what you identify as, and then I'll call you as such, right? So we got clear on that. But one of the people, I guess that she called herself trying to be a smart ass. And because it was birthing people, she was like, so what does that mean? My husband needs a doula too? And I was like, actually, yes. I was like, actually, yes, right? Because we provide education for everybody. Right. So that means that like the person who's having the baby, the aunt, the grandma, the husband, the wife, the partners, the partner, the kids, right? Like maybe they need a
All
little bit of
families.
understanding of what this can look like, right? So I think like if they can come in, you know, contact with a doula, get educated, like come to the prenatals. Like it's not just like a solo thing. Like with my clients, I'm very specific around like just know like a solo session because I may ask you things you may not want to talk about in front of everybody. Right. But for the ones that are like, we're gonna do the side of education and we're gonna do comfort measures. I'm like, bring everybody. I don't care. It could be 20 of y'all. I don't care. Bring right? Because this is going to be a group effort. Right? Like you're gonna be doing obviously the really hard work, but we're here to support you and support each other and getting you to whatever that endpoint is. Right. And then I think the other thing that can't be also like remiss is that childbirth education is so important. Like a lot of people are like, if I have a doula, like, or even if I don't have a doula, like, I'm going to childbirth education. I'm like, please go. Because if you have like free ones right in your area, whatever, if you have virtual ones, like even if you're looking at YouTube series that are free, like it's really important for partners to educate themselves. And whatever those partners are, whether it's romantic, friend, family, whatever. And then the other thing I would also say to partners is to really try to get clarity on your relationship to pain. Because a lot of times, if a person has a relationship to pain, which a lot of us do, that pain and discomfort means that something wrong is happening, they will feel not very great in the birth experience. Even if everything's going great, they'll feel like I have to save you from this pain. I have to save you from this discomfort, or I'm worried that something is wrong because pain and discomfort for me means that something is wrong, right? So getting clear about that, because a lot of times, like as a doula, you see partners where you're like, okay, you need a break, right? You need to tap out because
Yeah. You not
I can see
helping.
for you, that you're spinning in a way that
Yeah.
is impacting my client because
Yeah.
your relationship to seeing contractions is like, oh my
Yeah.
God, we gotta get away from this. And for me as a doula, we gotta push into this,
Yes.
right?
Yeah.
Because the more contractions, the better, generally,
Yeah.
right? But if you're giving it this energy of like repelling, and I need my
Mhm.
client to know that they're okay, and even to know this is the
Mhm.
natural part of the process, that things are going
Yeah.
well, and I know it's intense, and I know it sucks,
Yeah.
right? But we're getting somewhere, right?
Yeah.
And so a lot of partners, especially husbands specifically,
Mhm.
right? Like they're very much like, I want to save you.
Yeah.
But save you from what when everything's going well?
Yeah.
Right? So
Yeah.
it's
Yeah.
That's
important
the
for them,
word.
even like our grandmothers, like if they've had traumatic births,
Mhm.
and I talk about it like in my book, Birth and Liberation, I talk
Yes.
about a grandmother who had a really traumatic birth. And then
Mhm.
when the birth was happening, she was in her story, right? She was in
Yeah.
her story, what was going on for her. So it's really important for our partners, support people to learn, obviously like really support skills and like what's going on
Mhm.
and comfort measures or whatever they can learn in their capacity.
Mhm.
But it's also really important for them to get clear on,
Mhm.
when I come into this, what am I bringing into this? And if I feel like I'm
Mhm.
bringing a bunch of shit, I need to
Yeah.
work on that now.
Yeah.
Yeah.
Or I need to be clear about, is it going to be helpful for me to be in this space?
Mm.
That's
Right? Maybe my
word.
So
role is
true.
not to be directly
Yep.
24/7 in
Mhm.
his space. Maybe that's why we have a
Mhm.
doula, right? So maybe the
Yeah.
doula can do that. Maybe I'm passing. I'm an hour in, I'm an hour out. Like whatever it looks like,
Yeah.
because people have their own relationship to pain, to discomfort, and to birth. And I
Yeah.
don't need you to quite bring it in here
Yeah.
if it's not going to be
Yeah.
helpful.
Yeah.
Yeah. Yeah, I mean, you're so right. I remember in that the moments that we're like, well, Tiffany's laboring, I'm in there with her, and just saying things like your body was made for this, like anything that I was like pulling in, I don't know where it came from, probably the ancestors, like
Yes.
you can do this, like you are a divine portal. Like I'm just telling her because I'm like this Mo has to go away right now. Any fear that I
Yes.
have, we can't. You're right. Like it can't be in this
Yeah.
space. And it felt so sacred, like the ground was moving underneath our feet. And
Mhm.
it was this very beautiful experience that really helped me to understand the importance of the work that Tiffany is doing, that you're doing.
Mhm.
And I just want to say that out loud. Like it's really meaningful to me as a partner to witness the support that you all are pouring into the community, because I can see how
Mhm.
traumatic it's been. I can see how scary it is for people when we think of life and death. I think that
Mhm.
these two experiences they get
Mhm.
bad reputations in society. Like people want to lean out of them, but I want people to start really running toward them. They really make up what this existence is. So I
Mhm.
say that, and I'm like, get us back to you, Tiff.
No, it's
But
a really
thank
good
you.
point. Like you like really sparked something for me when you said that, because in the last 2 years I've been like really studying death work, right? And like
Mm,
literally on my face, I just did a conversation with the college. So like literally on my desk right now, it's like holding space on
wow.
loving, dying, and letting go, and like accompanying the
Wow.
dying. And it's really
Wow.
cool, but it's called All Living and the Dead. And it
Mm,
talks about all
Mm.
these people who are in professions that surround death, right? Some that you
yes.
Mm.
don't even think of, but they exist.
Mhm.
And the reason why, like, I love what you said is because I feel like, yeah, life and death is something that we all are guaranteed, right? To some level.
Mm,
And
mm,
I think we talk about the Black maternal health crisis. A lot of our avoidance of the numbers, a lot of our avoidance of really talking about it with clarity, right? Because we're like, oh, someone's having a birth. I want to like, and their education be like, Black people are dying, right? There's a lot of resistance to that because culturally we're all very afraid of death, right? Like
yeah.
culturally, especially in Western
Mhm,
society, like death is like,
mhm.
let's not talk about it. We only talk about it
Yeah.
when it's happening. And it's like, baby,
Mhm.
all thing I'm guaranteed to being Black and dying.
Yeah.
So
Mhm.
My mama said
maybe
that
I should
every
have a
day
little
of my
bit.
life.
Listen, so it's like in this space is like, how do we, the question that I kind of I guess grapple with is like, when I'm working with Black folks specifically? Like, how do we bring up dying in the crisis in a way of being coming from a space of empowerment, right? Because again, all we're guaranteed is being Black and dying. However, I want you to have a little control about this dying thing. Okay, like I just want you to have a little bit more control about it. Like, of course, we know that a lot of deaths, 60% at least of the deaths could be avoided when we talk about the Black mental health crisis. Right? That's a huge, huge number. And that's to say, for me, it's like, it's not like we don't have the technology. It's not like we don't have the knowledge, right? But we just have people, humans, making really terrible choices and making, dehumanizing other people for whatever factors, right? But it's like, we have to really, as a culture, especially Black people specifically, for many reasons, not only until like my death doula bag, but like become more acquainted with death, right? And like, not in the ways of like everything has to be sad, but more so being like, we know that these numbers are what these numbers are.
Yeah.
They are what they are. So how do we aim for learning, right, with the doula, charter of education, reading, whatever it is, about how to prevent this, right? And another thing that you said that came up when you were talking about like, I was saying these affirmations, I was saying these words. And I think we have to really be aware of how we can learn the knowledge of the spaces that we're inhabiting, specifically when we're in the hospital, right? Like, doulas tend to learn the language of the hospital, and we tend to be the bridge for our clients. So our clients are like, what?
Yeah.
What does that mean? Right? What are you talking about? Right? And like, even like one of the things I teach my clients and my doulas too, that I teach, like, if the doctor, midwife, whoever is coming in and saying like, we didn't do this thing, right? This next level of intervention. I'm always like, ask them, is it something that is urgent or not? Right. And it's even that simple conversation and teaching your client, teaching your family around what does it mean to be an emergency? What does it mean to be urgent? But what does it mean to be like, we have time?
Yeah.
Right. Like, that is something that like I try to teach my clients, or teach families and teach our doulas. Is like, the language is even a factor. So like, getting more acquainted with death, I think, is another big thing.
Yeah.
Because if we have that conversation, we're not fearing the cost. Some people are like, and I get it, there's religious factors, there's all sorts of things that come into it. But we're like, I don't want to talk about death because I feel like if I talk about it, that puts me in that space, right? Like, a lot of people are like, if I talk about it, that makes it real. And I'm like, but it's already real.
Yeah.
Right? It's already real because we have these statistics that show that it's real. It's real as it can get, actually. So it's like, it's like, just because you're speaking the word of death or having a conversation around like wanting to avoid your own death doesn't mean that you're putting negative energy into your space of like birth and beauty or whatever. It's more so to say, look, I'm being prepared for what can come this way. I'm learning the language. I'm learning what to look out for. I'm learning like what I can and cannot, what I can and can say no to. I'm learning about how to advocate for myself. But a lot of times that deep advocacy that can be done because we're all trying to like, I want you to advocate, but I'm also trying not to say that like this could lead to your death if you don't. And for me, it's like, this can lead to your death if you don't. And I'm not just saying that to scare you. I'm saying that because there's numbers showing me that can really happen.
Wow.
So yeah.
I love that you said that, Sabia. I mean, we all know, well, I think everyone here on this, at least in Mo and yourself, knows just the simple statistic of Black women are 3 times more likely to die in childbirth. The number, like the reception I sometimes get when I say that, it's like, oh my God, like it's such a like scary, like, why are you saying that? Like, in this very like, I don't even want to think about death. I don't even want to go there. And I love that you're talking about like, this is real. Like, you might not want to go there, but the longer we even avoid going there is how we continue to perpetuate some of these things. And so I think it's just very important for people to understand that, we have to talk about, it's particularly in birth work, we also have to think about death. Like, it's inevitable. And I am a person who has had a very interesting relationship with death over the years, one that has been very avoidant. And I realized that particularly for Black birthing people, it is very important for us to say the statistics, understand the risks, understand what happens if we don't advocate, understand what happens if we engage in these certain practices and approaches and behaviors, particularly in the birth space, I think is really important. So I really love that you called that out because it's something that I've been feeling. Even when I even say the statistic or I post it on social media, I understand that it can be triggering for people and
For
things like that,
sure.
which I honor.
Absolutely.
And
Sure.
I think that there's a level of like, girl, don't talk about that I receive. And I'm like, but this is real. Like these are
It
actual
is.
numbers.
Yeah.
It is. And I think like there's like so much to learn from our ancestors. And when we think about
Mhm.
ancestors, we specifically think about like older people, right? We're like
Yep.
Yeah.
ancestors. But like in the Black birth world, especially as Black doulas, I'm like our ancestor is Amber Rose Isaac. Our ancestors are
Mm.
people that have died that who were young.
Mm.
Mm.
Right?
Wow.
Like those are our
Wow.
ancestors, right? And
Yes.
they probably
Wow.
shouldn't be, right?
Yes.
like we
Mm.
have to know that there's so much to learn as
Mhm.
well.
Mhm.
Not just in the
Yeah.
Mhm.
sense of like moving forward on how we prevent, but what can we learn from past people that have died, right? Who
Exactly.
died,
Mm.
who have had preventable deaths, who have
Mhm.
Mm.
reached out to like Amber Rose Isaac, reached out to medical providers who have had these
Mm.
things, right? Like, so there's so much life, right? Like that can't be
Mm.
remiss. There's so much life for Black maternal folks, for Black birthing people. There's so much that we're doing. There's so many organizations who are doing the work. There's so many doulas and different care providers who are doing the work. And we can't miss out on the conversations of what happened to the people that are no longer here and what we can learn
Mhm.
Mm.
from them. Right. And it has to be
Mm.
all the same. And I think sometimes like
Mhm.
death can be triggering. It
Yeah.
can
Mm.
be so triggering, right?
Mm.
And there's a part of us that we have to do our own individual work to understand the difference between maybe a trigger and something that's necessary.
Mm.
Right. Like a
Mm.
trigger doesn't mean that we have to push it away and be like, never
Mhm.
will I talk about this
Mhm.
versus like maybe I need to work through this because people are
Mm.
Mm.
dying. And there's even
Mm.
doulas, right, who have a trigger with death. We're not obsolete from,
Yeah.
from
Mhm.
the conversation,
Yeah,
right? And it's like,
absolutely.
how do we even create a better relationship with that so that we're educating in a more
Right.
unbiased way?
Mhm.
Mm.
Mhm. Mm.
Absolutely.
Yeah, I totally relate to what you're saying because I think it is important to understand the difference between triggers and what's necessary because I think that's oftentimes a thing that
Mm.
comes up. Like
That
I'm
makes
feeling
sense.
triggered, which I am not making light of triggers
Yeah,
because
we
I think
also
it's a very
trigger.
real thing.
Yeah.
Yeah.
Yeah, but it's also like the decision of like, if I'm feeling triggered by this, right? Like, what is it telling me about what I need to work
Yeah.
through?
Yeah.
Right. And
Exactly.
like, we're especially as doulas, specifically as doulas and birth workers, like who are serving Black people,
Mhm.
right? If you have a specific, and Indigenous folks as well, because they also have really terrible numbers as well. Like,
Mhm.
if you're feeling really triggered about death, that is normal. That is what it is, right? But also be
Mhm.
mindful, like, if I have this trigger, so what level is this trigger impacting the way that I'm able to converse about certain things? And if I'm working
Mm.
with
Mhm.
Black folks specifically, right? Like, am I
Mm.
doing them a disservice, right?
Mhm.
By embodying this trigger and not telling them, like, these are the conversations that we need to have, not
Mhm.
because I want to have it
Yeah.
either, to be honest. But it's like,
Yeah.
Yeah.
but it's like I have to tell you that you
Yeah.
Yeah.
all are dying at higher rates and it's not your fault. Right. I have to
Mhm.
Yeah.
be very
Mhm.
clear about that. So I have to be
Yeah.
clear about the
Yeah.
language that we're going to use. I have to be clear about the techniques that we're going to use. I have to be clear about certain things. I have to be clear about that after you have a baby, I know a lot of people die from infection. We need to be very clear about what that
Mhm.
looks like. I don't want you to die.
Mhm.
Right. And I've
Mhm.
had a lot of clients too, like Tiffany, you may experience this now or in the
Mhm.
future where
Mhm.
they're so avoidant of certain conversation that it's hard for me to provide the care that I want to
Mhm.
provide
Yeah.
Mhm.
because I'm trying to
Absolutely.
Yeah.
tiptoe.
Yeah.
And I'm
Yeah.
like, listen, I'm telling you this, but this is a real thing. Like,
Yeah.
I
Yeah.
know what's not to like for me, I tend to
Yeah.
like, if I had to have that conversation, I tend to like try to tell them ahead of time ahead. Like, we're gonna have a very sensitive conversation. These are some of the topics that are gonna be included. Once we do this and we
Mhm.
grapple with it, we don't have to do this every time we meet, but I have to it feels
Yeah.
like I feel like I have to do this so that
Mhm.
Mhm.
you know that I make sure that you're going into a space, especially a hospital space, feeling
Yeah.
completely knowledgeable about the possibilities.
Yeah. So
And it's a
important.
conversation we shouldn't have to have. I shouldn't have to go to
Yeah.
people during the brightest time of their lives, mostly. I mean, I work with incarcerated folks and stuff, so like, it wasn't always the brightest time, but
Yeah.
generally speaking, a bright time to tell you about that. I shouldn't have to do that. But because of the system
Yeah.
that we're in, I have to. And I'm giving a disadvantage
Mhm.
to you if I don't.
Absolutely. I'm thinking so much of your work sounds like education and and of course like advocacy. And I'm wondering, let's say anybody listening will know about you so they can like make a beeline toward you. What do you think though in the system overall, like how do you think the system, let's say the United States could, and I know this is a lofty question saying the whole country,
Yeah.
how do you think the United States could better support people around education? What does an actual plan toward birth education look like so that people get this knowledge pretty much at their
Mhm.
doorstep and they don't have to go looking?
Mhm. 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 So a couple things. I think right now we're in this space where Medicaid is starting to reimburse doulas.
Okay.
And part of the reason why they're saying that's happening is like, because, Black Maternal Health, we want to make doulas more accessible and like all that kind of stuff. But in that has become a bunch of like hypocrisy because
Mhm.
some of the states are like, we're going to reimburse you a few $100s, and it's like that's not even enough. So why you have to have
Yeah.
a proper amount of reimbursement, and the speed of the
Yeah.
reimbursement can't be 3 months. We're not a hospital. We need it in 2 weeks.
Yeah. Yeah.
Then the next thing with that too is that there is in that process there is in some states there is a restriction of who you can train with, right?
Mm.
So a lot of the
Yeah.
community doula based programming, a lot of the, program that really centers people, honestly, all
Right.
types of people to create
Right.
spaces are being barred from being on that list,
Wow.
right? So when you think about that, that means that we potentially have doulas who are just not educated in a full spectrum way. Um,
Mm.
and also doulas are not motivated to become Medicaid doulas because they're like, I'm not gonna get paid enough. And it's also just a long
Mm.
process of like technical words and paperwork and all that
Yeah.
kind of stuff. So I
Yeah.
think that whole process has to be better because if you thought about like doulas being reimbursed the way that let's say physicians are, they even have low rates. I'm not saying that they don't either, but if they were actually reimbursed at their value and they were able to go to trainings that make sense for their community, right? Because different communities need different types of training. Um,
Yeah.
how much more doulas we have on the ground, who knew that they were going to get paid, that they can
Yeah.
make this a career, that they can serve their communities, they
Yeah.
can be in close proximity because they're in the community, right? So it's not
Yeah.
like I go to a hospital, like, oh, my doula is like, literally down the block, right? Like we're
Yeah.
in this space, right? And then so that has to be definitely created. I think the other thing when we talk about education is that I think we have to, and there's a lot of different organizations and people doing things, but we have to not be afraid of the good uses of technology.
Mm.
And I think sometimes, like, especially in this AI world that we're in, like
Mhm.
AI is not the answer to everything. So like, I'm not saying let's have an AI doula bot. I mean, if it's necessary, then
Mhm.
cool. But like, and I'm sure that it does exist somewhere, right?
Mhm.
But how do we use technology to get into the spaces that we usually wouldn't be in?
Okay.
And when I think about those spaces that we usually wouldn't be in, I think a lot of it is like rural spaces where there's just not enough doulas,
Yeah.
right? A lot of it too is like, what about the Black mom who works 16 hours during the day and at nighttime she wants to learn something about being, her pregnancy or her body anyway, right?
Mhm.
But like, there's just nothing open. There's nothing accessible. There's nothing there,
Yeah.
right? So I think like really utilizing technology in a way that um is helpful. And then the other thing I would say too is just like our money. When I say our money, not our money, not the people here, but like the money from wherever the people we having the money,
Yeah.
really going into putting money into the efforts that are already happening. There's a lot of
Yeah.
doula programs, a lot of doulas in general, a lot of birth workers in general, whatever it is, who already they're doing the shit. They're doing it,
Yeah.
right? But they just don't have the financial backing. right? So they can't build capacity and they can't sustain.
Exactly.
Right? So it's like, how do we just put money and like let them do their thing? Because they're already knowing their community. They're ready a safe spot. They're ready this. And with that, like we have to be careful about where our alliance or where how do I word this? Like there's hospital-based doula stuff and then there's community-based doula stuff.
Yeah.
Right? And I think when we have hospital-based, generally you're working for the hospital, no matter if the doula had or not. There's a restriction as to what you can say, what you can do,
Yeah.
how you can
Yeah.
move, right? And the strength of community-based doula programs is that it is something that is ran outside of the hospital. And there's so much strength in that because people build trust in that space.
Yeah.
Right? So I think like if we do those things, not saying they're all the solutions, but if we do like those three main points, we can get more education out there.
Yeah.
And inviting partners. The other thing I would say too, I know a few people who are doing like different spaces or different organizations for like partners, male partners, whoever partner, whatever it is, I don't care, support person.
Yeah.
Providing them with a space for them to go.
Yeah.
I don't want to say that's outside of the doula, but you know what I'm saying? But like space for them to be like, I'm a grandmother trying to support this. Where are they? Right? Like, where's that specific conversation? Or I'm a husband, or I'm, or whatever it is, like I'm in a poly dynamic and my poly wants to, like where can I go for this specific type of thing? So they don't feel like, I feel like a lot of partners feel like they're taking up the space that the pregnant person should be taking up. So they don't ask the questions. They don't get the education because they're like, well, this is not my space. And I'm like, where's the space for them so they can talk about the struggles of being a support person on that side of it?
Yeah. Yeah, that's a word.
That's super helpful.
It's very, very helpful. You really answered that question. I could see like a very dynamic approach. That would be a dynamic approach if we were able to create that level of education and supply the people who are already doing the work with more and more resources. That feels like a big part of what you said. So thank you for answering that. Yeah.
And, Sabia, as you're offering, some of these very practical tools or practical things that people can do, or even this country can do, as a whole, it makes me, kind of transition into our love resources section of the episode, which is what you can offer as offerings that you may have. You have a book, you have many organizations, or any things that you have read over the years that have helped you in your journey that you can share with our audience.
Let me see. Of course, I have my book.
Yeah.
Birthing Liberation, How Reproductive Justice is Free. And a big part of that to know, like, parents can read this book, and like that's the thing, and you'll learn a lot of things. But the book was really created for the people that care for birthing people. Because I feel like there's not enough like people like throw in the doulas, and I'm like, how about the doctors learn something cool, or other people learn something like maybe they really change their understanding of things as well. So it's really for people like I have a whole bunch of care workers, and it's been in colleges and this, and people are like, oh, this is giving me a real life understanding of the crisis and trauma and all that. So there's that. Obviously I have my organization Birthing Advocacy Doula trainings here. I usually actually don't wear any of my like gear this way. So I was like, oh my gosh, this is so cheapy. But it's kind of cool.
So
and I was
nice.
like, I need to like
It's
wear
perfect.
my thing.
Yeah.
And then like I would say I'll show it to you like more like nearly one able to start going with then. I have willing to work with hater. I'll say this. One of the books that I would suggest specifically for Black femmes and women is a Bell Hooks book called Sisters of the Yam. Is that what's called? The Yam? And the reason why I suggest that is like it's not they don't talk about birth in there, but it really talks about like different aspects of who we are and just like generationally, like things from like our generational connection to our mothers and our parents and the way that we are, always forced to be moving, and like the addictions that we tend to pick up, right? That aren't just like drugs, right? And so I feel that's something I would say. And then also, lastly, I've been telling so much about this. She would think that this person was my friend, and she's not my friend. So I got this deck, and I don't quite know how to say her name, but her first name is Jacqueline. Maybe Ogorchukuo. Oh my god, I'm so terrible at this. I'm so off. I'm sorry, Jacqueline. But she wrote the book, Racial Wellness, but she has these thing called Tender Reminders. And they're like these cards that are about like 50 healing affirmation cards for Black, Indigenous, and people of color. Okay, you want to do a card together? We're gonna do it.
Yes.
Okay, so she has like there's individual, so you do things like individual reminders and individual things, the interpersonal, and then she also has dream, right? And we're gonna do a dream thing. I've been using it because I'm a spiritual director. And I've been using it in my spiritual direction space.
Wow.
Okay.
And okay. Are we ready?
Yes. Ready.
Okay. Okay, so this is the reminder, and then I'm gonna do the question.
Okay.
And we can think about this in reference to the maternal health crisis.
Okay.
Yeah.
So like the reminder is never let go of your ability to disrupt worlds that do not work for us and dream up worlds that do.
Wow. Beautiful. So appropriate.
Question. What is my vision for creating a world without white supremacy?
Ooh. Wow. That's powerful.
Okay. Sabia, you went with it.
I love to go there. I love to go there. And I love things that help me to go there because I'm like a there kind of person.
Yeah. Do you want us to answer this question?
I want you to answer it. And I think in reference to the Black maternal health crisis, and then I'll go.
Can you repeat the question one more time? I think I got it, but I just want to make sure.
What is my vision for creating a world without white supremacy?
What's on my soul is that it starts with me. That's like what's coming up for me is that part of my journey is to embody this world that I want to see exist. So that's in how I walk, how I talk, how I show up in a space like I belong there. So much of my own journey has been not dimming my light out of fear of shining too brightly. And so if I see this potential for a world where all people's bodies, their birthing experiences are valued and we and are sacred and their lives matter, I need to keep showing up to those conversations, continue to treat everybody in that way, continue to talk boldly and love out proud, if you will. That's my Instagram handle. Be loud about this equality that I want to see. I think sometimes I've been quieter because the people who are sometimes loud and wrong have like such a loud megaphone, it feels like, in a large platform. And I'm like, well, people aren't going to want to hear that from me. But at this point in my journey, I'm realizing that people do want to hear. They are thirsty for positivity and to dream about a world that's better. And so it's like, let's create that together. But it starts with me. That's what's coming for me.
And your name a lot as to why I'm like honoring y'all, because I was like, yes, I want to hear what y'all be talking about. Like I want to see what y'all talk about. Like, you know what I'm saying? Like when I think about that world without white supremacy, it's just like the emphasis on Black joy, it's an emphasis on love, it's an emphasis on and we're doing this in spite of, right? And I think that's like the work that y'all do. But anyway, go ahead, Tiffany.
Wow. No, thank you.
I was literally gonna say that the basis of the Earth app being Black birthing joy is our birthright has really just stuck with me, because so much of this work is crisis. It is trauma, it's chaos. And I personally believe that birth is one of the most beautiful things
It
on the
really is.
planet. I think it is one of the greatest rites of passage of all time. And I think that it goes beyond just the 9 months and the birth. It goes
Yeah.
through childhood. Like, we all were birthed into this world. And so I think it's
Mhm.
really important to show the joy, show all of it, show the whole of it. And
Mhm.
I have been a person, who has struggled with sometimes even feeling okay to share my joy
Yeah.
when there's so much sadness and grief around me,
Mhm.
even in the
Same.
birth space particularly, having
Mhm.
gone through journeys of pregnancy with people that I started out with that, may have experienced loss through that process. And so
Mhm.
to continue on my journey and feel joyful and happy and excited while other people may be experiencing a level of challenge has been difficult. And it is something I'm really challenging myself to keep putting out there and keep doing, because I
Mhm.
think showing the
Yeah.
whole of that journey is
Yeah.
so
Mhm.
important to me, because I think that it's, that's what wholeness is, like showing all of it, being transparent. And so I think that that would be me owning my role in this question that you're
It's
asking.
a deep question.
Mhm.
I like that's really and like when I think about this question, my vision for creating a world without white supremacy. It's a space of I don't know, three things I'm at. One, like the space of like centering our healing like consistently.
Mhm.
Mm. Mm.
Um, I think that like we're always healing. There's never an end
Yeah.
Mm.
point. And I know like
Yeah.
in my own journey, especially the last like 2 months, I'm really I've been much more transparent about like me being a spiritual director and me doing like these different
Yeah.
things. And I really felt like kind of like what you're saying, Tiffany, like a
Mhm.
fear of like, what if I'm saying these things that like I'm excited about?
Yeah.
Like,
Mm.
how would that be received? Like,
Yeah.
and that shouldn't be the case, right? But I also think that that's like a big part of white supremacy is like, how do I like
Mhm.
make myself smaller to blend in?
Yep.
Um,
Yeah.
and I think too, like a part of the transparency is something that I envision without white supremacy because I believe that white supremacy tells us that we have to either be like really, really happy all the time, or
Mhm.
we just have to be blank. Like there's no
Mhm.
like
Mm.
In
fluctuation of
between.
emotions.
Yeah.
Like I know
Mhm.
Mm.
like in my journey, people are like, you're so transparent because I'm like, ooh, I'm really frustrated about this thing, or I'm not feeling it today. And I'm like,
Mm.
I don't know if it's like I'm being transparent. I'm just saying what I feel because we all feel so locked in to like this box that we have to be
Yeah.
perceived in, right? Like there's just everyone's like I have to be really happy or I have to like really be quiet about any other
Mhm.
emotion,
Mhm.
right? And I think like because of that, like Black birthday people also experience that. And like this is why we also see like especially for Black women that depression looks different. We're actually very much more
Mm.
active. We're very much more whatever because we've been told through the white supremacy I can't have a fluctuation of emotions. I have
Yeah.
to either be happy or I should still have to be in action. That's it.
Mhm.
Mm.
Yep.
Right? There's no in between. I can't be sad. I can't be this. I can't be that. Like that kind of thing. And I think, a world without white supremacy, it just looks like variety. Like it just looks like
Mm.
we're just so like put in these stupid systems that are like
Yeah.
and we're just in these binaries, right? Like
Mhm.
you're
So true.
masculine, you're feminine. You go to the hospital,
Mhm.
Yeah.
or you're living a wild life, or doing a home birth. Like you're doing
Mhm.
Yeah.
this, doing that, and it's like
Yep.
there's so many in between spaces. Like I tell
Mhm.
people all the time, like, I'm a person that I just had a hysterectomy a couple months ago. Like happy about it, oh joy,
Mhm.
right? But even
Mhm.
being
Mm.
in the birth world, and especially being in like there's this understanding what family units look like. If you're a
Yeah.
woman, somebody, you never wanted to be pregnant, that's even
Yeah.
problematic, right?
Yep.
And it's
Yeah.
like, well,
Mhm.
I'm living my happy. I'm so happy.
Yep.
Wow.
Mm.
Yeah.
And it's like, but it's even like how we like feels around like, can I show that? Can I do this? Because it's always just like
Yeah.
dropping this level of like comparison about how my journey has to look for it to be like the model. And I think a lot of us, like some of us, like, I don't give a fuck about nothing. But then when it comes to being transparent, they're not, because they still have this comparison in their mind. And it's usually based on white supremacy that I have to be, exist like, whatever. And I just want all that to be gone. And if it was gone, so many people would be so much freer.
Oh my gosh.
Absolutely.
Hence why your work, your book, Birthing Liberation, is so important. You are on the ground doing this work and sharing it with the world, and I think it's so important. And you kind of just took my would you rather moment, but I love that.
I love it.
I love it. It was such a great exercise, and it really,
seriously,
yeah, I feel touched. Like, I feel like at a loss for words. That was
this is gonna be with me for like hours and hours. Like, I'm thinking about Sabia. You gotta be
to
wanting
hang
to call.
out.
Yeah, absolutely.
So,
that's a must.
Yeah. And I'm gonna try to look cute for y'all.
You look cute now. I'm a sucker for deep conversation, so this is everything.
This is like, I'm Black, and there's like a certain thing that comes with Blackness, but like, if I pop in, just like the skin is gonna do what it needs to do. You know what I'm saying? But so it's like giving, like, I'm Black. Wow.
Yeah.
But I would put a little bit more effort. You know what I'm saying?
Okay.
Wow. That's what I'm saying.
Okay.
Aren't y'all so happy to be Black though? Can we talk about that for a second before we go? Like, what are we?
Yeah.
Absolutely.
Absolutely.
I really love being Black. Like, it really like lights me up every day.
Yeah. I feel you on the just
that.
waking up, putting on moisturizer and going. I didn't know after transition. I'm like, what am I going to do without makeup? Oh, actually, I don't have to do anything.
For real. Like, and now it's like, I'm in my like sunscreen era. You know what I'm saying? Because like, we gotta like protect.
Yes.
You know what I mean?
I'm in my sunscreen era too.
Wow.
And then with this type of weather, when the light is hitting, and you look at yourself and you see your skin, and you like, baby, it's popping. Okay.
Listen, I'm gonna be in Costa Rica next week, and I'm gonna be like basking in the sun in a healthy way, though, because like, not trying to like mess up what's going on here, but like, I'm really excited to just be in the sun, to be in nature, and to just like, I'm gonna be topless. I'm gonna be topless most of the time. And I'm just like very happy about, I don't know, just like feeling joyful and like, I remember I'm literally putting in my calendar where I can put my laptop down, because you also know that I'm an avid, like, I work a lot, but scheduling time to put my laptop down, and like, even with the Black Maternal Health Week, like, being mindful about like where my thoughts go with that. Like, there is a lot of trauma that goes into that, but also be mindful that part of my responsibility as a Black birth worker is to take care of myself and to feel joy and to celebrate, right? Like, celebrate myself, celebrate people that do this work, and know that like, when we were brought to this fucking land or whatever we're on, like, we were not supposed to be here right now. We were brought over here to work and then be gone, right? And the fact that we're still here, the fact that we're still thriving, the fact that we're still in spaces together, like, we have to keep that in mind and celebrate that every day.
Yes.
Absolutely. There's so much thriving beyond that, like, survival mode that we were put in. There's like just been a lot of thriving, and we haven't often as a culture talked about it, because in order to get the reparations or to even talk about what we've been through, we have to keep bringing it up. And that's been it's a difficult balance. It's like, we need you to not forget what we've been through, and like why we need this equality that we're asking for. And we should also be able to ask for those things while excelling in spaces, so that people don't forget, though. They go, oh, well, they might look at me and Tiffany and say, oh, you went to these institutions, or y'all are good. It's like, well, now wait, we got a lot of loans. Our parents had to take out loans to get us that. Like, it's stuff that went into that.
Yes. And I think too, that's also the importance of like being in spaces that are just people of color, that are just, it's not that like, I'm very transparent in any space that I'm in, but there's still a level of like there's just conversations and things we do when we're just with us. Right? There's a level of safety sometimes that we experience when we're just with us. And I think that is sacred.
Yeah.
My girlfriend's in the other room. I saw her episode of this podcast, and she was like, "Oh my god, please don't have me on there." Like, what? She's a nervous. She's a nervous lady. Y'all don't need her. But I also just look at her and I'm like, "Oh my gosh, we're Black and queer." Like, oh my god, like, we just out here.
Yeah, just out here.
Do you know what our ancestors were trying to do? They were just trying to get it in. They couldn't even get it in. What? I'm like, now we're just out here being cute, wearing matching outfits.
Yeah.
Wow, love that.
I love that for us.
Yeah. And we get to enjoy all of that. Yeah.
Yeah, I was creating families. I don't know about me. I don't know about who having action dolls. I'm very content right now.
And that's the family. Our daughter has a book that says "Love Makes a Family." That's a family.
That's it. I'm like so content. So I'm like, I don't know. We'll see. I'm 35, and I just have my uterus. So I know I'm not carrying a baby.
Yeah.
But yeah, I look at y'all and I'm just like, so sweet, so sweet.
Oh.
Thank you for saying that.
You
Thank
are
you for
so
the work that
sweet.
you're doing, Sabia. It is sacred work. It's so important. It's so necessary. I'm so glad to be connected. I'm so glad that we met and we had that conversation because
thank you for like having the like audaciousness to just come up to me because I am like come up to me, which is not whatever, but not everyone does it. So the fact that you're like, hey, this is where I'm at in my journey, like I'm good. And it was cute. I know it was cute. Then you have a little
I remember she was super cute.
I was pretty cute that day. I do say so myself.
I'm like, oh, I wish I would give as much effort as Tiffany gives. Like, oh my god, please.
I appreciate
that.
Put
a Google on me and take me outside. Like my girl's always like, if I put on like something else, she's like, "Are you okay?" Like you put on more effort. I'm like, girl, you get what you get. Leave me alone. Y'all looking cute. Y'all doing a thing.
I appreciate it. I so appreciate it. Sabia, let the people know how they can connect with you on social or however way they can reach out to you.
Yeah, so I'm most active, I would say, socially on Instagram. I think because I'm a millennial. Like I do have the TikTok, but like you're going to see me and my girlfriend doing stuff. Sabia Wade is all that, and then my website if you want to learn about all the things I'm doing is sabiawade.com. And yeah, and I'm like, if you ever want to reach out, say a thing, I like do actually check my messages on Instagram. And whatever, just reach out.
Awesome. Thank you so much.
Yeah, we really are grateful for you coming on the podcast. Thank you for honoring us this weekend. I'm looking forward to that. And you know, this episode will come out after. I'm so excited. It's gonna be beautiful. It'll be great to hug you in person. I'll get to meet you. And but thank you for your wisdom. You dropped so many gems on this episode. You really pour your heart out here and shared so much about why you're passionate about the work you do and why the legacy we leave matters. I'm just going back to that earlier point that you made about how being yourself is a necessary part of the legacy. So many of us have legacies that were built based on like making other people proud or, you know, moving on other people's dreams. But it's
and I think
clear
people
that
have to be really like your legacy can be what you do. It can be right. It's what you choose to do and like what you've done. But I really want my legacy to be how people experience me.
Yes.
Yeah.
Absolutely.
Yeah, we say all the time we want our legacy to be love. And like if I wake up, I know I've accomplished what I'm supposed to do that day. If I've been loved, that's my self-check. Were you loved? Okay, we did enough. If I didn't finish that email or I didn't do, were you loved? Because at the end of the day, that's what we'll be remembered by. That's what is going to make the mark. So that's my standard for myself. And I just really appreciate that's obviously you flow in that, you just bring that. And we're just so grateful to have you in our lives.
Thank you for having me. I feel so honored.
Thank you.
Oh my gosh, I love when Black people invite me to do things.
Thank you.
I'm like, we could really do the thing. Like, I'm ready. So thank you for the invite. Thank you for the work that y'all do. thank you for like how you make people feel. And also for like what you represent. Obviously, like there's queerness and there's whatever, but I think there's like togetherness. Like there's things that come up beyond your identities that I think people really vibe with. And I just see y'all doing like whatever your goals are, that times 10.
Wow.
Thank you for saying that, Sabia.
Thank you for speaking life into us. And just like we received that. Thank you.
I receive.
Yeah. You are clearly in your calling as a spiritual director. So
yes.
I feel that. Yeah. Well, I'll let you close out this episode too.
Well, thank you again, Sabia, for being here. Happy Black Maternal Health Week to everyone. Thank you for holding space and just being a part of this community, doing this amazing work. And for everybody listening, I just feel really moved. So I just really appreciate it. Happy Black Maternal Health Week. This has been an amazing, amazing episode of the Be Your Own Love Goals podcast
with Moe Ari
and Tiffany.
Have a great day and be well.
Bye. If you're listening to this on Apple Podcasts, don't forget to rate, review, and subscribe. Video episodes are on YouTube and Spotify.
If you want your question included in an upcoming episode, feel free to reach out to us on Instagram at Be Your Own Love Goals or check out our website at lovegoalspodcast.com. We look forward to hearing from you soon.
Bye.